All right, so just to make sure you're in the right room, we're going to talk today about administrative career pathways in healthcare and CHCs. Often the conversation is more about clinical pathways, but healthcare is a rich field, and there are lots of opportunities within healthcare that don't necessarily involve being a clinician. So we're going to talk through some of those pathways today. So let me start by doing introductions. My name is Katharina Westby Sharman. I'm the Vice President of Operations, so that's over all of our clinic operations and patient experience here at Healthpoint. And joining me is Tonda Madden, who is one of my partners. And in a second, Tonda will tell you a little bit about her background as well. So let me start off by just saying a few things about me and my background and perspective so that you have an understanding of where I'm coming from. I have about 31 years in healthcare and started off as an analyst after getting my undergraduate degree in just general management. So I lucked into healthcare. That's the way I look at it. I have been doing lots of different things. And the first job that seemed to use my degree was in healthcare. And I thought, wow, this is really neat because what I'm doing is what I was trained to do is more business oriented things, but I feel like I'm doing it in something that's so much more important. I had worked through school and banks and some other things and just really felt like I wanted a mission. I didn't mind doing business oriented things, but I wanted to be doing it for a greater purpose. So I feel like I backed into healthcare and I haven't left it since. I've loved it. And I've grown up in it and had the opportunity. I've really been blessed to explore lots of different types of services that I've worked with in lots of different positions. So I've worked in talent management, I've worked in behavioral health, I've worked in primary care, I've worked with ancillary services, and over time I've slowly progressed in leadership roles and opportunities to reach the point I am 31 years later. So I feel very blessed to have had those experiences, and it also gives me a very unique perspective when people wonder about healthcare roles. Because I've tried so many different things, I've got a unique perspective on what's possible. I think that was about all I was going to share. Oh, the other thing I was just going to mention is healthcare has never been more interesting or challenging when you think about the pandemic that we've all been surviving and trying to survive. It's been a really challenging time, and it's about really removing barriers and caring for people at a really intense and important time. And the pandemic, even when COVID and mask wearing goes away, we've still got a lot of recovery to have happen. This has hurt people in many lasting ways. And you'll hear as I talk about Healthpoint a little bit more, it's really hurt the communities that we serve. And so my passion around this is going to continue for some time. And it's exciting to be a part of an industry that can really impact people's lives and sometimes save them and certainly make our communities healthier. So that's why I'm in healthcare and why I'm doing what I'm doing. Tomorrow, we're opening up a drive-through vaccine site, a brand new point of access. So we've been running around doing that. And if I have little team windows that pop up, that's because there's a lot of coordination going on. But that's the kind of stuff that we're doing now, and it's pretty exciting. All right, I am going to go on mute here and flip it over to Tonda.
Hi, everyone. My name is Tonda, but I go by Tonda Madden, and I have been with Healthpoint 14 years, actually. I've got about 17 years in healthcare as a whole, and prior to healthcare, I was in customer service, restaurants, most likely. And I love service, the service industry. I love pleasing people. Unfortunately, when I worked for restaurants, the hours and the weekends and the nights and the holidays kept me away from my family a lot. And so a relative was in healthcare, and she said, we're hiring. Do you want to come try your hand over here? And I said, yeah, great benefits, great hours. And it gave me that same good feeling of service and helping people. And I've never left since then. I started in our contact center. So one of the reasons why I'm here with Katharina is we do work together closely, but she thought I would be a good example kind of for the students. I started in our contact center 14 years ago. I did have some supervisory background and some college education, but I started there and was able to show my leadership skills and wanted to advance and wanted to grow and wanted to learn. So then I was promoted from there to one of our sites as a front office supervisor. Did that for a couple of years and kept wanting to grow and learn and take on bigger responsibility. So I became a site manager after that and did that for about 7 years. And then also, still wanted to keep growing and learning. A couple of years ago, I was given the opportunity by Healthpoint to become an operations leadership fellow. So for the last 2 years, I have worked with Katharina, our vice president of operations and patient experience, and others at the executive level, and just really learned Healthpoint as an organization. I had the site experience down, I had the contact center experience down, but really have worked on many, many, many projects over these last couple of years. And of course, with COVID happening, that focused us all this whole last year. And it's been really, really, really fulfilling for me to get to see all of the people we're helping again, because I am in an administrative position now and I'm not working day to day with people. But us starting testing sites, us starting vaccine sites, us going out in the community and vaccinating people has really, really, really been a special time and rejuvenating time for me after 14 years. One other thing I want to add is that working for a community health center is significantly different to me than working for just a medical facility or company. I've worked in private practice and a couple other different areas, but the people we serve, the people who choose to do this work, it's never a dull moment, and people are here for the right reasons, and it's very, very, very fulfilling. So just a real quick synopsis of how I got here and where I am, and hopefully showing you a little bit of how you can come here and there's nurturing and growing and growth opportunities within Healthpoint. Thank you.
I was going to tell you just a little bit about Healthpoint and also about CHCs. And the reason I'm talking about CHCs, we'll go into in a little bit, but because they're a really great venue for folks who are thinking about getting into healthcare. So that's one reason. I think the other reason is I think we all care about our communities, and we've learned a few things about where there are disparities and gaps and how we can make a difference. And if you're thinking about healthcare, I'm guessing you're thinking about it for some of those reasons. So Healthpoint started in 1971. As a CHC, and we've grown. Our service area is King County, but we're more in the residential King County versus downtown type areas. So we've got 19 locations. We're mostly on the outside. So we've got Bothell and Redmond on the east side. And then as you come down the bottom of the sound, we've got Renton and Tukwila and SeaTac and Midway, Des Moines area, Federal Way, Auburn, 2 sites, including our residential training for our providers. And then in Kent, we have our Kent and Kent Urgent Care. And I didn't mention in Renton, but we have 2 different community sites, as Skyway and Sunset, as well as our downtown Renton site. And then our administrative site, and our most recent addition has been our drive-through partnership with Public Health for a COVID testing site in Renton. And we're adding a vaccination site at the same location for our patients. So quite a few different areas. We've also got, I believe, 4 different school-based programs that we've opened up right now. And that's where we provide healthcare clinics within a high school. So that's a unique program. We're doing that in the South King County area. So that's a little bit about Healthpoint, and our mission and vision really are about making our communities healthier. And we believe that by providing really good quality care, removing barriers to care, and that's a lot of what we've all been talking about, that we help improve the health of the community. Which takes me, I should give you a little bit of a gentle warning too. At the very end, we're going to give away 3 Amazon gift cards that we will email to you for $20 each. And Tonda is going to ask you some questions at the end. And if you know the answers, then you're going to win a gift card emailed to you. If you don't, we'll keep them. All right, so pay attention. Here we go. All right, why work for a community health center? So as I mentioned, we were talking about different pathways, but in particular, I'm also talking about the pathway of administrative positions through community health centers, because I think a lot of folks are aware of the big healthcare systems that are out there. Community health centers are different, and they're different for some important reasons. For one, we are serving those who others may not be serving. And we really are thinking about the disparities that exist. So for instance, we're providing care in the South King County area. And as we looked at COVID outcomes and those who were getting sick and those who got sicker during this pandemic because they weren't getting care, South King County area was one of the hardest impacted areas, actually almost in the nation. It was really, really marked. And that's the area that we're trying to serve. And so I think that that is an important mission. But so, I'm just mentioning here that we're serving BIPOC and marginalized communities. And that includes marginalized either because of socioeconomic, immigration status, housing or food insecurity. All of those different things are all issues that we deal with that compound your ability to be healthy or even access healthcare. And CHCs also recognize that safety and the sense of feeling like you understand me, all of those things are influenced by our decision to hire from our communities. So we try to represent the communities we're serving in our hiring decisions and in our employment. And we feel that that does two things. One, it makes it feel safe, like this is my community and they understand me when they come to us. But it also helps improve our community by providing education and training and career pathways. And that improves financial security for folks, and also lets them have a chance to give back to their communities that they live and work in. The other piece around it is that we tend to be very education oriented. Healthpoint in particular, we have multiple education pathways and we like to grow our own. So we're trying to reduce barriers also for our employees. Education can be expensive and difficult. So we have scholarships that we've worked with things like Salau Credit Union. Tonya was one of our scholarship recipients with one round. We have our fellowship program, which allows you to experiment and try different projects and work. We do a lot of on-the-job training. So there are many different pathways around getting what you need to continue to the next step in your career. So that's a little bit around CHCs. I want to mention that there's a lot of really wonderful organizations just in the King County area that are also CHCs. So Neighbor Care, CMAR. CMAR is bigger than just King County, but they are also in the King County area. ICHS, Country Doc. I think those are all the ones that are in the King County area. So if you're interested in finding out more, I just noted there, you could go to our website, but there are other CHCs in the area. If this is feeling like a calling, go check them out. All right, so let's talk about why you came here today. So I said a lot of context, but mostly what I wanted to help people think is just, if healthcare sounds good, there are a lot of different pathways you can take. And just because you start down one pathway doesn't mean you have to stay with that pathway. My career, and a part of where I got where I was, is that I was curious and I explored a lot of different areas. And over time, those things came together to help me be a pretty good operations leader. And so I think part of it is just what sounds interesting, what's curious to you, and then finding where you thrive and where your natural talents come to play. So I'm going to mention a couple of these areas that can be entry level. And then I'm going to talk about how almost all of those could build and grow over time. So customer service and direct patient care. So I talked about this being non-clinical, but there are a lot of positions where you are actually talking to patients or seeing them face-to-face and having a direct impact with patients. So for those who really enjoy interacting with others, there's quite a few of them. Our front office patient roles are great because you get to learn how insurance works and a little bit about the front end of how revenue is generated through healthcare. Even in a nonprofit, we still have to pay the bills and learn about insurance and all of that stuff. And then we have customer service, contact center, and those are really fascinating jobs where you learn deeply about the business, all the different types of services that are involved, and the insurance mechanism that essentially runs the healthcare business. And most of these things are things that get taught on the job. really to come into these jobs, they're looking for people who are comfortable with technology because you're using technology to check people in or make a pointing. And they're also looking for people who have a real passion that they care about customers. And by the way, if you're bilingual, that's even more fantastic. So this is really, they're looking for skills about caring, about good customer service, and about ability to manage technology. So those are pretty low thresholds to enter, but there's a whole bunch you learn on the job that then sets you up for future career paths. Additional ones, we have navigation staff. So that's learning about the resources in the community and helping patients connect with them. Our client services reps help patients get insurance or connect them with other resources in the community that may be interfering with their care. A lot of different pieces can go in that. A whole nother track would be the health information, and you can actually get certificates in this that are not full degree programs, or you can get full degree and graduate programs on it. Health information is pretty fascinating if you think about the way we share information now, and how when that information is shared, coordination of care is so much better, and we have fewer mistakes because we know what's happened to folks. So if you're in the hospital, then those notes are available to a care team following that. If you've had an allergic reaction, that information is available so that you're not prescribed something that would cause that to happen again. All of that is facilitated really by health information management and working with electronic health records and around access to information. And there's a whole bunch of new things coming out that are changing that industry and making it pretty interesting. Again, many positions there, it's just about being really good with technology and accuracy and data and working within those constructs. Information technology and analytics. I think a lot of folks figure, oh, you've got to have a lot of degrees to do this type of work, but many of them are more, again, entry level. So if you think about help desk or tech support, you get trained on the basic things, and it's, do you have good customer service? Can you remember those concepts? And can you bring them to bear in serving either patients or serving your internal customers, which would be the staff. So a lot of entries into there if you've got some real technical skills and still like helping people, but there's so much more. There's the development of electronic health records, and there's so much of that. And I've noticed that we've done a lot of kind of teaching our own people how to work within it and get them to the next level. And so that can be really interesting if you have a more technology bent. They wouldn't hire me if their life depended on it, but I have a lot of respect for them. Talent management pathways. So that can be lots of things. There are recruitment, there is learning about benefits, there is maybe starting as a coordinator that's helping organize and help onboard people. There's training, lots of specialties within the talent management piece. And in those cases, you're really kind of focused towards internal customers or bringing people in and helping them understand the brand and making a really positive experience as they come on board. I mentioned revenue cycle in the top piece, but the revenue cycle in finance is kind of what keeps healthcare on the tracks, if you will. And that can be a really rich and interesting area to learn as well. So it can be, again, are you good in customer service? Are you decent with technology? And then you can learn the rest, but it very seldom requires a full degree program. However, as you advance through that, there's opportunities if you're willing to consider additional education. And we'll talk about that in a moment. So as I go into the last one, which is around healthcare, leadership, supervision, and management, each of these areas, so for instance, customer service, our best customer service reps end up becoming leads and then tend to be promoted to supervisors, managers, and or directors over the time. Same with front office. We have a front office supervisor, and our high desire is always to find those really good front office folks and promote them to the supervisor mark if they have an interest and a desire to do it. And then from there, we start developing their supervisory skills and thinking about what their aspirations are and what their interest would be. Very natural. Site manager would be a next progression for that. And then either a practice manager or a business director or something along those lines. So that would be kind of a whole operations, front office, business operations leadership track that can last an entire career and be actually fairly profitable even in a nonprofit for someone working in those areas. Yes, Liesl.
Catherine, just a 5-minute warning.
Okay, thank you. Perfect. We're moving right on time. So any of these tracks, as you can imagine, You can be better at any of them if you are doing things like certificate programs that help you dive deeper into the content and really become specialized, or thinking about degrees that are actually particular to that field, or you can go through a healthcare management type track and then have specialties within that area. So lots of ways to continue to expand careers once you get that baseline experience and knowledge and show yourself as a high performer. All right, so the most important part, because we can't go that fast, would be questions and prizes. So this is where we'll open it up. Are there any questions about healthcare fields or different things that you guys have thought about? What has this provoked for you?
You can unmute. Oh, sorry.
Go ahead.
You can unmute yourselves, or if you prefer, send something via chat.
And I don't know if I have the chat open. Can you see the chat, Tonya?
Mhm.
Okay.
And I think Liesel's monitoring it.
Okay.
I'm supposed to be monitoring the chat. It says, what are programs where we can explore these careers?
So by programs, do you mean health or like education programs?
Yes.
Okay. So I think there's a couple different places. So for instance, if you're thinking that you like the idea of healthcare and talent management or human resources, there are certificate programs out there. So some of those, like there's an organization called SHRM, I think, that has actual certificates, and you can find some that are particular to healthcare or talent management. You can also think about getting, if you're wanting a 4-year program or an AA program, quite a few schools have things in healthcare management. I know that I have, my master's has a healthcare management certificate that went on in addition to it. And in that area, they actually took you through understanding quality and finance and talent management and all these different aspects of the business of healthcare management. And in that process, you find out more about it. And I've actually taught classes along those lines. And that can be a way to kind of explore the different aspects of healthcare and see what's most interesting to you if you know you want to do that. It also prepares you to be ready to be a leader in healthcare, having had those contents. But there's also really specialized. So if you're thinking you like IT, but you want to work in healthcare, I would look at IT programs, and then within there, look for specialized either certificates or tracks that you can take that would address specific healthcare related issues. So in general, I think the other thing I want to mention is that there are also public health degrees that you can think about as well. And those will get you thinking more about kind of the general public and a lot of the data.
2-minute time warning.
Okay.
And I think it's gonna, if there's no more questions, we're gonna segue into asking some questions. But I would just add one more thing to what Katharina said. A lot of the 2-year colleges have administrative, like medical assistant, well, a medical assistant, yes, but also administrative medical programs as well. Like 9-month programs. And a lot of people that we've hired or I've hired in the past have taken those, and they have done really well. But then a lot of times, if you just have a customer service background, or like Katharina said, are a willing, passionate person, we can start you, at a entry-level position, and then you can find out different paths as well. But and then of course there's the traditional 4 years and masters and things after that. Well, I want to say thank you for attending, and hopefully you all felt like you got some great information. And then hand it back to Katharina to close out.